Before you make coffee tomorrow morning, I need you to watch this very carefully. Most strokes do not happen at random, and for many adults, especially over 60, the highest risk window of the day is not the afternoon. It is not during exercise. It is not when you are stuck in traffic or dealing with stress. It is the first few hours after you wake up. That is when blood pressure rises fast. That is when dehydration from the night is still in play. That is when circulation, medication timing, sleep quality, and morning routines can all collide in the worst possible way. And some of the things millions of people do every morning may be quietly increasing their stroke risk without them realizing it. The dangerous part is this: several of these habits look harmless. A few of them even look healthy. But the timing is what changes everything. And one of the 7 I am going to show you starts while you are still asleep. Today, I am going to walk you through 7 common morning habits that may be raising your stroke risk. Some of these are fixable in less than a minute. Some require one conversation with your doctor, and one of them is so common that a large percentage of people watching this are probably doing it right now. Number 4 is the one people defend the hardest. Number 7 is the one almost nobody connects to stroke. I am Dr. Clara Hoffman. This is the conversation most doctors do not have time to finish in a 10-minute appointment. So let's have it now. Here is what we are covering. One habit starts the moment you open your eyes. One involves what you drink first. One involves a breakfast food marketed as heart healthy. One involves the pain reliever millions of adults take without a second thought. And one involves a warning sign that people dismiss because it disappears too quickly. Stay with me. Because if you are over 60, if you have high blood pressure, diabetes, atrial fibrillation, sleep apnea, high cholesterol, or a history of TIA, these morning habits matter more than you think. Let's start with habit number 1, getting out of bed too fast. This sounds minor. It is not. When you are asleep, your body is in a different cardiovascular state. Then you wake up and your system begins to switch gears rapidly. Stress hormones rise, blood pressure starts climbing, heart rate changes, blood vessels respond. If you go from flat to standing in seconds, especially if you are older, mildly dehydrated, or already on blood pressure medication, that sudden shift can put extra strain on circulation at exactly the wrong time. Most people do this without thinking. Alarm, sit up, stand, walk. But the body does not always adapt that smoothly, especially after 60. My advice is simple. When you wake up, sit on the edge of the bed for 30 to 60 seconds before standing. Let your body adjust. Let circulation catch up. Give your blood pressure a moment to stabilize. It takes less than a minute. But in medicine, the smallest timing changes often matter the most. Habit number 2, coffee before water. This is one of the most common morning routines in the world. And I understand why. People wake up tired, they want the caffeine, they want the ritual, they want to feel normal as fast as possible. But after 7 or 8 hours of sleep, you have already gone the longest stretch of the day without fluid. For many older adults, that means waking up relatively dehydrated. And dehydration does not help a circulation problem. It makes one harder to manage. Then the very first thing many people do is reach for coffee. Not water, not hydration, coffee. Now let me be clear. Coffee is not the villain. The problem is not coffee by itself. The problem is coffee first in a body that has not yet replaced overnight fluid loss during a window when blood pressure is already rising. That combination is not ideal, so the correction is not complicated. Before coffee, drink 1 full glass of water. Do it before breakfast. Do it before your first errand. Do it before your first scroll through your phone. 1 glass. First. It is one of the lowest effort changes on this list. Habit number 3, taking your blood pressure medication on autopilot without ever discussing timing. This is where I need to be precise. I am not telling you to change your medication timing on your own. Do not do that. What I am telling you is that far too many patients take blood pressure medication at the same time every day, because that is how it was originally written. Not because anyone revisited whether that timing still makes sense for them. Blood pressure follows a daily rhythm. For many people, it drops during sleep and then rises sharply in the early morning. That early morning rise is a known high-risk cardiovascular window. So the question is not, should everyone take blood pressure medication at night? That is not the question. The right question is, given the medication I take, my blood pressure pattern, and my age, is my current timing actually optimal for me? Most patients never ask that. They assume timing is fixed forever. It is not always that simple. Medication type matters. Dose matters. Other conditions matter. Falls risk matters. Nighttime blood pressure matters. So if you are on blood pressure medication, ask your doctor directly. Is the time I am taking this still the best time for me? That one question is worth asking. Habit number 4, doing vigorous exercise too soon after waking. Now listen carefully because this is the part people get emotional about. Exercise is protective. Long-term, regular exercise is one of the best things you can do for your brain, heart, blood vessels, blood sugar, mood, and blood pressure. That is not in dispute. What I am talking about is timing. If you wake up and within minutes you are doing all-out cardio, heavy lifting, hill sprints, intense intervals, or anything else that drives heart rate and blood pressure sharply upward, you may be stacking that intensity on top of an already vulnerable physiological window. You are taking a system that is still transitioning out of sleep and asking it to redline immediately. For a healthy younger person, that may be fine. For a 67-year-old with hypertension, carotid plaque, diabetes, or a prior TIA, that is a different risk calculation. The answer is not to stop morning exercise. The answer is to stop treating the first 10 minutes after waking as if your body is already fully warmed up. Insert a buffer, hydrate first, walk first, stretch first, move gently first, then train. That small change may be the difference between helpful stress and unnecessary stress. Habit number 5, a high-sodium breakfast that looks healthy on the label. This one catches people off guard every time because the foods sound responsible. Whole grain bread, turkey slices, instant oatmeal, low-fat breakfast sandwiches, cottage cheese, packaged egg bites, vegetable juice, heart healthy, low-fat, high protein. People see those phrases and relax. But what they often do not check is sodium. And sodium matters because sodium pushes blood pressure upward. And blood pressure remains the single most important modifiable stroke risk factor. Now think about the timing. Morning is already when blood pressure is climbing. If your breakfast is heavily processed and sodium loaded, you are adding fuel to the exact pressure spike you should be trying to soften. This is especially relevant if you are older, already hypertensive, salt sensitive, or taking medication to control blood pressure in the first place. So here is the one thing I want you to do this week. Read the sodium label on your breakfast foods. Not calories, not protein. Sodium. Just that one check. Because sometimes the problem is not what you think is unhealthy. Sometimes the problem is the food you stopped questioning years ago. Habit number 6. Taking ibuprofen or naproxen as part of the morning routine. This is extremely common in adults over 60. They wake up stiff. Their back hurts. Their knees hurt. Their shoulders hurt. They reach for ibuprofen, naproxen, or another NSAID almost automatically. Again, I understand why. Pain is real. But so is the trade-off. These medications can affect the kidneys, promote fluid retention, interfere with blood pressure control, and in some people raise cardiovascular risk. That matters, especially in someone who already has high blood pressure, vascular disease, or multiple stroke risk factors. What makes this so dangerous is not just the pill itself, it is the routine. Every morning, same time, no review, no reassessment, no one asking whether the pain strategy is now creating a blood pressure problem. If you use ibuprofen or naproxen regularly, do not panic, but do take it seriously. Review it with your physician. Ask whether it is still the safest option for you. Ask whether your blood pressure has changed since you started using it regularly. Ask whether there is a safer pain control strategy based on your medical history. Do not assume over-the-counter means low risk. For some patients, it is not. Habit number 7. ignoring the stroke warning sign that shows up in the morning and disappears. This is the habit that causes the most damage because it does not feel like a habit. It feels like rationalization, a strange headache when you wake up. A brief episode of blurred or double vision, a hand that feels numb for 2 minutes, speech that feels slightly off and then returns to normal, a moment of dizziness, imbalance, or confusion that clears before breakfast. People dismiss these episodes constantly. They tell themselves they slept wrong. They stood up too quickly, they need coffee, they are getting older. But sometimes what just happened was not fatigue. It was a TIA, a transient ischemic attack, a warning stroke. And the cruel thing about a TIA is that it resolves. That is exactly why people ignore it. The symptoms leave, so the urgency leaves with them. That is a mistake. If you have sudden weakness, numbness, facial drooping, speech trouble, vision loss, double vision, or a sudden unexplained coordination problem, even if it lasts only minutes, you need urgent medical attention. Not later today, not after breakfast, not after a nap. Urgent evaluation, because the body sometimes gives a warning before a full event. And the people who do best are often the ones who took the warning seriously the first time it happened. Now I told you one of these would begin while you were still asleep. Here it is. Untreated sleep apnea. If you snore heavily, wake up unrefreshed, gasp during sleep, wake with dry mouth, or feel exhausted even after a full night in bed, do not dismiss that pattern. Sleep apnea is not just a snoring problem. It is a blood pressure problem. It is an oxygen problem. It is a vascular stress problem. And untreated sleep apnea is strongly associated with a higher risk of cardiovascular disease and stroke. What makes it relevant to this conversation is that it sets up the morning badly. You wake into the day already physiologically stressed, already poorly rested, already more vulnerable. So if you or someone you love has obvious sleep apnea symptoms and has never been evaluated, that is not a sleep issue to ignore. That is a stroke risk conversation waiting to happen. Let's step back. None of these habits guarantees a stroke. That is not the point. The point is that morning is not a neutral window. For many people, it is the most fragile window of the day. And if you repeatedly layer the wrong behaviors into that window, fast standing, no water, unreviewed medication timing, immediate intense exertion, sodium-heavy breakfast, routine NSAID use, ignored warning symptoms, untreated sleep apnea, you are creating a risk profile you may not even realize you have. That is the danger, not one dramatic mistake. 7 ordinary ones, repeated daily, quietly, for years. So here is the reset. Wake up and pause before standing. Drink water before coffee. Review your blood pressure medication timing with your doctor. Warm up before you exercise hard. Check sodium, not just calories. Do not treat daily NSAID use as harmless. Never ignore sudden neurological symptoms, even if they disappear. And if sleep apnea is on the table, address it. That is how risk changes. Not through one miracle supplement, not through one trendy hack, through ordinary corrections made consistently. That is what preventive medicine actually looks like. I am Dr. Clara Hoffman, and if this gave you one useful thing to act on tomorrow morning, then it did its job. This video is for educational purposes only. It is not medical advice, and it is not a substitute for speaking with your own physician. If any of these habits apply to you, especially if you have high blood pressure, prior TIA, atrial fibrillation, or other vascular risk factors, bring them to your doctor directly. And if you know someone over 60 who starts every day with 2 or 3 of these habits, send this to them now.